Frustrated with high hamstring tendon pain? Then this video is for you. This is the third video in the series. We've done 2 previous videos to help you get to this stage, but now you're at a crucial point in terms of returning to full-on sprinting and competition. My name is Tommy Brennan. I'm the owner of the Pain and Performance Clinic based in Lucan in Dublin. Thanks for checking the video out. I'm here with Aaron. We're going to go through 4 exercises that you need to do in this late stage. Check out the previous videos on this, which you can see here, which are going to help build capacity in order to get to this stage. Up to this point, we've pretty much avoided anything that compresses the tendon against the sit bone. But at this stage, if you've done the previous work, we now need to push it back into that because they're movements that your hamstring needs to be able to tolerate in sport. The key point with this is you do not have to have 0 symptoms to return to activity. This is tendon in nature, which means you can have an ache and pain in your daily life. Loads of people have the mindset where they go, I've got pain in my life, so there's no way I'm able to compete or do sport, when actually it's almost the opposite. You need to do these previous exercises to bring the pain down, warm the tendon up well with those, and then move into these exercises here, which is going to allow you to get back to your sport. The more of that you do, then the quicker your pain is going to go away and the less pain you'll have in your life. So stopping and resting and just getting to 60%, honestly, the answer is just by going straight through it here. If you have any questions on that, comment below, reach out and we'd be glad to help, but that's an important psychological barrier for a lot of people. Okay. Let's get into the final stage exercises. So they're a little bit more dynamic, more compression of the tendon against the sit bone. We're starting off with kettlebell swings here. So as you can see, when Aaron is doing it, he's hinging here like this. And as he's doing that here, probably feel a little bit of hamstring activity and snapping the hips forward. You will have warmed up with the exercises from phase 1. 2 or 3 rounds of that would be your warm-up, so the hamstring is going to feel nice at that stage, and then you can go into that there, which exposes it to a little bit more dynamic movements, 8 to 12 repetitions in a set, but have it a little bit explosive. Second exercise we're going to do is advance on the hip thrust. We're going to go into the B stance hip thrust here. So just going through some of the details on it to make sure you're doing it correctly. Start off by lying on your back and bringing both heels in as far as you can. So say we're going to work the left one, are we? Yeah. So the other one comes out a little bit, but it's still on the ground for support. Now, push down through to lock it out there. Back is flat on the ground. All Aaron's intent is going to be through this heel and hips up at the same time. And in this position here, you're going to hold it for, let's say, 10 seconds and take a break. And again, most of the intent is here, and you're also actively trying to squeeze this area here. When you're doing this, do you feel a lot more work on that left leg? Yeah, definitely. And down. Okay, so choose a weight where you can do this maybe 6 to 8 times without feeling it anywhere else. Your back shouldn't be getting sore. It really should be right up here in that area. It's not necessarily always the heavier the better. Sometimes you go heavier and you're actually working your shoulders and your back more. The purpose of this is to feel around that area doing the work. Decent weight, 6 to 8 reps in a set. And with all of these exercises, you can decide whether you do anything from 2 to 4 sets, depending on your training plan and what you have on in the week. Third exercise we're going to go into is an RDL exercise. So this is where there will be a lot of compression through it, but at this stage in your rehab it should be able for it. So hinging through the hips here, pushing the other leg back to the back wall. Everywhere else is relaxed, and you certainly should feel the hamstring muscle working and almost stretching there. It can feel slightly achy, a little bit more achy, up around the tendon area. That's fine, but it absolutely always has to be bearable, and you should never feel worse afterwards. If it does, don't do the exercise. It means you're not ready for it, or that one just doesn't suit you, and there are lots of other options. Final exercise in our return to play, the triple jump. So we're going to take a look at Aaron here, just being as explosive as possible. Okay, and just walking back. So triple jump like that, and you might do 4 of those in a set. You should be equally as competent on one leg and the other. If you're doing this yourself, you can't be doubting yourself, unable to go. These are really good to do, not only for the physical adaptations you're going to get from it, but also psychologically, so you actually have the confidence to go despite there being a slight little bit of extra awareness there. That's absolutely fine. Don't wait for that to be gone before you get back to your sport. Like I said, it's almost like you need to fully get back in order for that to completely go, and that's only going to happen if you actually work this properly with enough load, going through the stages that we've spoken about. And I know it can be a barrier and a challenge for people, so like that, if you have any questions or comments, comment below and we'll be glad to help. Thanks for watching.